Namaste everyone. Welcome to your prenatal asana series. We are going to practice Anantasana today, also known as Lord Vishnu pose. Lord Vishnu is a highly known divine being or the god among the Hinduism culture, and his resting position is quite well known in the Hindu culture, as we see in many pictures. So in the similar manner, we are going to come into a resting position, but even though it seems easy, it has many benefits to coming into this position. Now, for the pregnant women especially, they tend to lose their balance because the center of gravity shifts during the prenatal phase. So it's important for them to even gain the slightest balance by trying to balance their body in various asanas. And second benefit that they get is they strengthen their nervous system, just even with a smaller practice to come into a slight balance with their body. The third most important benefit is that during pregnancy, their lower body goes through a lot of congestion, and it also eases that congestion in the lower body. Now we are going to practice 5 different variations of it. You can choose which one you would like to give to your students. Before we enter into asana, with the supine asanas, it's important to remember that in third trimester, the weight of the belly, the weight of the uterus, the baby grows. So when the women lie down on their back straight away, or even while sleeping, lying down on their back, it's not good for their health or the baby's health, because that puts pressures on the main blood vessels, and hence it stops the blood flow and the oxygen flow to the baby. So if your student is in the third trimester, that means the 7th, 8th, and 9th month of their pregnancy, it's important, if you're suggesting any supine asana, ask them to either do the variation of the asana, or even if it's important to lie down on their back, they can bend their knees. Anantasana, usually in first and second trimester, you can begin with the supine position by asking the woman to lie down on their back. But if the woman is in the third trimester, you can ask them to lie down directly on the side. In my case, I'm in my 9th month, so I shall be lying down directly to my side. So the way we practice this is we come in onto our side. Our left hand shall rest under our head. So we come to one side, and we always ask the women to take the support of one hand while coming up or going down, so that their belly feels always supported, and they are not jerking the lower back or the other body parts at any point in time. Especially this jerk should not ever enter into the uterus area. So you lie down on the side, and this is the base position. For many women, even breathing into this gently or staying comfortable into this resting position can also be difficult. So remind them not to hold their breath at any point, and try to breathe in very gently and normally in this position. Inhaling and exhaling. And once they stabilize, if they have strength and balance, you can suggest them the second variation, which is bringing one leg onto the other thigh here, and try to balance here. Now, in some cases, the belly can be very heavy, or this can give a lot of discomfort underneath the belly.
So for that, they can either keep a slight cloth or something like a mat, slight mat that I have underneath the belly, so that the direct pressure does not go onto the stomach. Now, if this is comfortable, the third variation is they can lift their one leg, and even try to touch wherever they can or hold their thumb, big toe. And ask them especially not to hold the breath in this position. Trying to balance here for as long as possible, but long and deep breathing is very required. And stretching and balancing as much as their comfort zone is very important. So wherever they can bring their leg in, wherever they can hold is good. The idea is to relax and not to stretch too much. So slightly coming back. Now the fourth variation we can suggest is lifting and holding and hugging one leg. And long and deep breathing here also. Trying to balance this one. And gently coming back. Now the last variation, which is adding a movement to Anantasana, is lifting one leg, inhaling, and bringing it down, exhaling. Either just in the third variation, we lifted the leg. In that, we can hold the leg. But in this one, we can bring motion. 1, 2, 3, 4, and 5. And gently coming back. Now, while coming back, it's important that they take support of their other hand, and on the floor, they keep their right hand and then come up, coming into the sitting position. Now it's important to remember various conditions of a pregnant woman while practicing this asana. The first condition can be a cervical stitch. A cervical stitch is a stitch given to her cervical zone if there are chances of miscarriages in certain cases. It's a medical procedure done by doctors to avoid miscarriage. And if the woman has cervical stitch, it's important not to stretch the leg upwards. We are not supposed to open the pelvic area during the presence of the cervical stitch for the woman. The second condition can be placenta previa, where the position of the placenta is downwards around the cervix, opening. Now here, the idea is not to, again, avoid a premature delivery or miscarriages when the placenta is not placed well. So in that case also, we are not opening the leg, just relaxing the leg. So it's important to know the condition of the pregnant woman while suggesting any variations of the asana. Now the third condition can be that she has high sciatica pain, back pain. In that case also, if she's lifting the leg, she can only go to up to 30 to 40 degrees maximum, because this position actually can help in the back pain as the lower body congestion lessens. But at the same time, if she's stretching the leg too much, it can intensely increase the pain. So remembering these things are very important. Now the fourth important point is if the woman is in the 8th or 9th month and her balance has decreased to a certain degree, and in 9th month, the lower back can need a lot more support than in other months of the pregnancy. So what she can do is slightly shift to the back and take wall support, and then lift the leg or try to balance her body. These are the things that you should remember while recommending Anantasana.
Thank you.